Welcome to the. Boop. Let's try that again.
Welcome to what now?
Welcome to Flu Talks. More health, less
bullshit. Oh man, you know what? Let's do something crazy. So
What? Jesus.
today's Flu Talks is going to be, let's ask random strangers what they think or what they know about IVs. I'm gonna go get a stranger from outside. We're gonna sit them down here. We're gonna ask a bunch of.
What do you mean a stranger from outside?
I mean, I'm not gonna ask you what you know about what you think about IVs because I mean,
Obvio, microbio.
okay. So you're gonna go with me?
No, for what?
Flu Talks, more health, less bullshit.
wait.
Today we are gonna go find a stranger and we're gonna play 20
Well, good
questions.
thing that our office is in a shopping center because. What are you
Go
going
get
to
a stranger. I don't,
Okay, but don't get
make it up. Watch
Listen.
this. This is gonna be amazing.
Don't grab like a crazy. Oh my god! Don't grab a crazy, please. Grab a semi-normal.
Follow me.
Grab a semi-normal human, please.
Pretty much, we're gonna find a stranger. We're gonna ask them what it is that they think about alternative medicines, if they know anything about vitamins, anything. Let's see if there's anybody out here. Should we go in the nail place? No, let's not go in the nail place. Of course, when you need somebody, you can't find somebody. Maybe that lady. Ma'am? Hi? No? Not that one. Right here, this guy. Excuse me, sir? Completely random. I completely understand that it's weird as hell with the camera watching us. My name is Daniel, owner of Fluless Mobile Wellness. Hey, real quick, bro, let me ask you, do you mind if we've got a podcast going on right now?
What is this, cheaters or something?
No.
My girl around?
Your girl. No, man. So pretty much, I own a mobile wellness company, and what we're doing is we want to know what the public thinks about vitamins and the use of vitamins, what they know about vitamins, and if you've ever done vitamin infusions or anything like that. Pretty much right now we're recording a podcast. It's called Flu Talks, More Health, Less Bullshit.
Okay.
Would you be interested in coming back to our office so you can sit down and just talk a little bit about health, man? Is that weird to you, or you got this?
All right, I'm down.
All right, man. It's not cheaters. Nobody's gonna pop out of the bushes,
yeah.
bro. I got you. Come this way, man. What's your name?
Darren.
Daniel,
Yeah.
man. Nice to meet you.
What's the podcast about?
So pretty much the podcast is just educating our community about the different things that they can do to be able to be safe and healthy. We're a mobile wellness company. We've got a company that pretty much is on the mission to care for this community by offering vitamin infusions and different kinds of services that will help people feel great in the comfort of their own home. Welcome to my office, man. Pretty much, I don't know if you've ever seen one of these. This is what the back end of a podcast looks like, all right? This is the setup, man. And if you want, you can have a seat on this comfy couch. We'll put this all back together. And I appreciate you, Darren.
I feel like a star now.
You feel like a movie star, man? Got them badass shades going on. You are a movie star, man.
Take them off for you. It's bright in here.
Got the lights and all of that stuff, man. That's how it goes.
All right.
So Darren, right?
Yes, sir.
Darren.
Yes, sir.
Pretty weird, huh? Didn't think that you were gonna be on somebody's podcast today.
New experience, but you know,
New experience.
I'm open-minded. So.
You're open-minded. What do you do, man?
So I have a video marketing agency. We do a lot of event video marketing.
So you've probably
Entrepreneur. Yeah.
Entrepreneur. That's what I'm talking about, man. As an entrepreneur, what do you feel like? How does health play into you being successful or not successful?
This is interesting because, I think as an entrepreneur, it's like we all want to be high performance.
Okay.
And, being high performance means that your sleep is dialed in, your focus is on point, you're sharp, you have mental clarity, like all of these things. So that's really like a core focus of, being an entrepreneur is being able to be high performance.
Now, with all of the different, we'll start with vitamins, and there's also medications, and you can all go all the way up with all of the different things that there are for people in general to feel incredible, do you take advantage of them? Like, what do you take so you'd be able to be sharp, focused, productive, all of that stuff? What do you do on a daily basis to be able to maintain that? It's okay to say not much. It's okay to say not much. You're not by yourself.
Not much, like vitamin C and like B12 and D3 and things like that. But like,
Do you know what all those things do?
kind of like antioxidants with the vitamin C, and
Okay.
D3 is like it's. I don't know. I've heard bits of
We
information.
picked the right guy.
then-
We picked the right guy.
and
We
I'm
picked the
like,
right
yeah.
guy, man.
Yeah.
All right, so pretty much every single one of the vitamins that you that you express, we do carry these. Now, there's a huge difference between taking these things by mouth and then injecting them into your body, where you're gonna end up having the benefit of a higher dosage in your body. So let's say you take vitamin C, usually it comes in 500 to 1,000 milligrams. We end up putting about 20,000 milligrams in a regular IV bag. So 20 grams or something like that. So we're going to put in about 20 times the amount of what it is that you can ingest by mouth.
Are we doing this today?
Are we doing this
happening
today?
right
You know
now?
what? I'm going to hook you up with one of these for
That'd
free
be
when we're
crazy.
done here, man. But
That'd be crazy.
what kind of questions would you have about a service like this? I mean,
Yeah.
and to let you know, these are the vitamin infusions that have gotten very popular. That, I mean, a bunch of people in Hollywood and stuff like that are doing it.
Yeah.
It's not all about the flash and I want people to know that I'm healthy, so I'm doing this. These things actually help people feel incredible. What kind of questions would you have about this?
So I've actually like known about this for a while. I haven't done it, but I was like very pulled towards it.
Okay.
And I'm just more so curious on like, what does it really do for you? What are the benefits of it, and how long does it last, and how often do you need to keep coming back? So what does it really do for you?
All right. I mean,
Yeah.
great question. I don't think you're by yourself on this question. And I know that a lot of our viewers are with you on this. The huge difference between taking vitamins orally and taking it in the IV route, like I said, it's the amount that you can put into your body. Now, the vitamins, ultimately what we want for these vitamin infusions to do for our patients is we want you guys to have less inflammation in your body. Inflammation is pretty much the cause of every single disease. Inflammation slows down blood flow, and we know that a lack of oxygen, the statement says, the absence of oxygen is the presence of disease. So if we can get rid of the inflammation, pump the body with vitamins that are going to make you create more red blood cells, you end up having more oxygen capacity. You'll be able to sleep deeper and better at night. You wake up with more energy. You're more focused. This is what we're looking for, and this is what the different vitamin infusions do. When it comes to, like, let's say NAD, NAD is probably the best thing that we have to offer for our patients. The amount of focus and energy that you get from NAD, it's almost unreal. I remember the first time that I ever did NAD, I almost got scared because I had never had quiet in my head like that before. It seemed like it was just clear,
That's crazy.
clear,
Yeah.
focused energy, and I was able to actually think properly. I don't know if it's that it got rid of the brain fog or what, but the mental clarity is a huge thing that we're looking for. And as an entrepreneur, I would expect, I'm an entrepreneur as well.
Yeah.
This is what we need the most.
Yeah, of course.
We need to make sure that our brain is functioning properly, that we've got enough energy, that we have the strength to not only keep on being producers, but also be a strong
Just organized. I think that's like clarity is like being organized and knowing, okay, I'm doing this, having that deep focus. And that's amazing if, NAD does that. I gotta try some of it.
it also regulates your circadian rhythm. I mean, how do you sleep, man?
Not good.
Not good?
No.
It's probably because you got a bunch of stuff going on in your head, so you can keep on being successful.
Yeah, and
You're
then
not
go
by
to bed
yourself.
late and then wake up super early, and then so it's a bit crazy. Do you guys have like IVs to help you sleep better and to
So yeah, so we've
restore
got
the body? And
we've
give
got
you-
IVs for recovery, for focus. We take care of pregnant women at home. I'm not sure if you got a pregnant misses at home, but we'll definitely take care of her if she's got any vomiting and stuff like that.
Yeah.
Sick patients, that's our number one thing that we love taking care of. If you feel like garbage, 45 minutes later, we come to your home, we take care of you in your home. I mean, you're here in our office today, but as an entrepreneur, you think you've got time, 45 minutes to an hour, to come over to somebody's office so they can be able to take care of you?
If it's worth it. But if I'm super sick in bed, like obviously convenience is a huge plus, right?
You think it's better to get taken care of at home, or do you think that you should go to an urgent care where you're gonna have to make a line, wait 3
Definitely,
hours?
definitely.
And then,
Yeah.
this is what we built this business for, man.
Me-
What other kind of questions do you have about vitamins and stuff, man?
Well, what are like some of, I guess, your greatest success stories with when it comes to, the IV drip and everything like that and the services that you guys provide? Like,
All
what
right.
are the biggest transformations that you've seen?
All right, so I'll tell you one of the coolest stories.
Tell
that
me
we've
on it.
had.
Tell me on it.
Tell you on it.
Yeah.
All right. So, well, I'll give you two stories. One, we had a lady that ended up having fuck, what is that called? What is the drip in my face?
Down syndrome?
No, it's palsy, but it's Bell's palsy.
Okay. Wow.
So I'll
Yeah.
give you two incredible stories that I personally have seen. It's pretty awesome, man. So we had a patient that she had Bell's palsy. Bell's palsy is almost, it looks like you had a stroke, but you
It's like
didn't.
nerves and
Exactly.
switching.
So what happens is usually there's a viral process in the body, and it has reached the brain somehow, and the inflammation that the body causes to be able to protect itself, now it's pressed up on one of the nerves, one of the facial nerves, and it ends up giving her a facial droop. Well, family called us up and asked us if there's anything that we can do. We completely understand the power of the anti-inflammatory process, the anti-inflammatory properties that vitamin C has. We gave her an extremely, I mean, I say extremely because people are going to be thinking, oh my God, but we gave her tons. Well, we gave her a high dosage of vitamin C and a bunch of the other vitamins. We called the next day to follow up, how we do with most of our patients. We want to know that what we did actually worked. The lady's granddaughter says, yeah, she woke up this morning and she's been whistling all morning. So I took it as, oh, okay, she's in a good mood. She said, no. She hasn't been able to whistle in the last 6 years because
Wow.
of the facial droop that she has. We got rid of that with one vitamin infusion.
How
something
long?
that doctors
So how
went-
long did that take?
45 minutes. In 45 minutes, we got rid of what doctors couldn't get rid of in 6 years. And the reason why is
That's crazy.
sometimes they're going after the wrong thing. Yes, this
Yeah.
is caused by a virus, but is the virus really the problem? And the difference between alternative medicine is we kind of think a little bit different. So, yes, we understand that a virus is the cause of it, but is the virus really the cause of it? It's a virus that has been dormant in this person's body for a certain amount of time. And once the immune system ends up going down, that's when this virus comes out to play. Well, there's your first problem. The immune system is low. If the immune system wasn't low, the virus wouldn't come out to play. So we've got one issue we got to handle. Once that virus came out to play, the human body attacks by creating inflammation. There's your second problem right there. So if the immune system didn't tank for some reason, and the virus didn't come out to play, there'd be no inflammation. Well, the inflammation ultimately is what ended up causing the facial droop that caused the Bell's palsy. So why go after the virus when you should just be going after what caused that virus to come out and play? So we boosted up her immune system, we gave them the right vitamins, and we gave her incredible amounts of a natural anti-inflammatory, and we were able to be successful. Now, is that going to happen with every single one of these patients? We hope so.
Yeah.
But it definitely felt good, man. And
So
another incredible story was we had someone that had uncontrolled muscle movements for 6 months. We won't get into the details of how it is that they ended up getting these muscle movements, but there was a shot that was going around that a bunch of people were taking. This kid ended up having muscle movements, uncontrolled muscle movements 2 weeks after that. Mom calls us up. She's taken her child to all kinds of different doctors, all kinds of different neurologists. They've got 25 different neurologists that were taking care of this kid. They've done every single CT scan, all kinds of brain wave activities. They were looking for everything that they could to be able to help this kid out. They put him all kinds of medications. They first started with muscle relaxers. After that, they put him on medications for seizures. You know that kid wasn't having a seizure, but they tried
Yeah,
everything.
they over medicate them with all these opioids and
Hey,
just
listen,
things that have side effects to
when
them.
I got my hands on him, the kid was on, I think it was 1 milligram of Xanax a day. I mean, it's a 16-year-old kid,
Yeah,
and
that's
you've got him.
developing.
Exactly. And now you've already put him into a system where Big Pharma's got their hands all over him, and that's going to be a patient for life. I mean, benzodiazepines are the
Crazy.
hardest medication to come off of.
Yeah.
So we went over there. We gave him a very high dose vitamin C infusion as well. We added some NAD to it. Um, the next day, I got probably the most incredible phone call I've ever had in my life. They were gone.
Wow.
Mom called
In
me
a
up.
day.
One IV.
Is
We got
it
breakfast.
muscular dystrophy? There's something
No,
called
no, 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 no. It
muscular
wasn't muscular dystrophy or anything like that.
dystrophy.
It's just he had uncontrolled muscle movement. So pretty much he looked like a 16-year-old kid that had Parkinson's. I mean, I got there and this is what
Wow.
he looked like. He was just
Wow.
sitting there shaking. So I mean,
And what
it,
was in that IV?
so I gave him 250 milligrams of NAD. I gave him 30 grams of vitamin C. And we ended up putting the rest of the vitamins that we put in our immune boosters, zinc, bicarb B complex, just regular vitamins that are going to help his body. But the anti-inflammatories is what I really thought the problem was. They've been gone. So I took
Wow.
care of him about 8 months ago. I
Insane.
follow up with mom continuously to make sure that he's still okay.
Yeah.
But it's the miracle of vitamins, and I mean, it's incredible what it could do. What it could do. I mean, the mission, the reason why it is that I brought you on. I mean, we've got a lot of people that are watching this.
Yeah, yeah.
We want to know what it is that holds people back from using vitamins to feel better instead of going the route of medicine.
I think it's education, right? Like just not being informed enough to know that like this is going to be better for your body. A lot of people have symptoms and the symptoms are usually uncomfortable and they want to find that quick relief. And I guess for a lot of people, they just don't, their awareness isn't there that vitamins is the first, call to action, first solution
Yeah.
to start with, right? So it's like, I don't know, it's like culture as well, right? Like everyone's just like, give me the Tylenol, give me the, I need to get rid
The
of this.
Motrin, the
Yeah.
medications, the anxiety.
Or the
give me-
doctors, especially the doctors, right? You go to the doctors and it's like, that's the first thing they're prescribing is some heavy type of drug. And for my eczema, they prescribed me prednisone.
Woof.
Yeah, and it was like
Oh, man.
and my dad
I have a personal issue with prednisone. Prednisone is an incredible medication for what it does, but the side effects that come with prednisone,
yeah.
it's almost disrespectful to the human body.
Yeah, I started seeing a holistic doctor, and they were telling me like, yeah, you can take all these things, but they're gonna have side effects that create other problems. And I'm like, wow, that's really how the whole pharmacy industry is like created. Is you give them one thing, but then it's got all these runoff side effects that bleed into more health conditions.
That keep you a client, that keep you a customer.
Exactly. I have a question. So, what is the most common disease in America?
Oh, I would expect heart conditions. I mean,
And so,
yeah.
does this help?
Well, look
heart
at it this way.
conditions?
Heart patients, I wouldn't say that it's gonna fix any type of cardiac issue, but if you've got the right supplements in your body, that means that you're gonna have the incredible amount of energy that you usually don't have. If you sleep well, you can wake up with enough energy to be able to invest time in yourself to exercise. Once you put that together, you're gonna bring down the percentage of you having some type of cardiac issues. Once you start exercising, then it's probably that much easier for you to start eating better. So the use of vitamins, vitamin infusions, what we have to offer, the way that it would work out to help out somebody not have the risk of cardiac disease. It's using the benefits to your advantage. So use that excess amount of energy to start exercising. Once you start exercising and you start feeling better, start eating better. Once you start eating better and exercising, you'll sleep better. Once you sleep better, you'll wake up with more energy to be more focused, and now you could be more productive. So all of it hand in hand does help out not only cardiac issues, but wholeness. The whole human body is going to be doing a lot better.
Yeah.
And you have a whole lot healthier lifestyle as well.
Interesting. And last question.
Yeah, man.
Because I'm curious, because I'm honestly really learning, like, that's what's prevented me from doing it for a long time is education on this, right?
Okay.
And so what about cancer, right? Is this like...
Now you're just going to get our podcast. Now you're just going to get our podcast shut down.
It's really...
Well, cancers are great. So look, we've taken care of, we've been able to take care of a lot of patients. We don't ever say that we have a cure for cancer. There's absolutely no way. But what we do is we support cancer patients through whatever therapy they're having. Whether whether it's the holistic route and they're working with a doctor that's going to try to fight hard with vitamins, or if they're in the process of doing chemo and radiation and stuff like that. Patients that are in the process of chemo and radiation, they end up very dehydrated, a lot of nausea, they have issues trying to eat. So we've taken care of them the day after those therapies. We'll come into their home and we will offer them Zofran. We'll give them Pepcid. We'll give them fluids and vitamins to help energize them, get rid of the symptoms that they're having that isn't keeping them from having a normal lifestyle. Now, cancer patients are in tons of pain, but just add on to their not being able to eat and not having the energy from supplementation of eating properly. So it's always been a blessing for us when we have cancer patients to take care of. And then even more so,
For sure.
the biggest blessing is when we're there from once they're in remission and they're survivors, man. It's a great question.
Of course.
Cancer. So we definitely don't treat cancer patients. We don't have a treatment for cancer, but we do support every single patient that is going through that.
Nice.
And I mean, we definitely want them to know that they can count on us.
I have one last question.
What's that?
Just one more.
One last question.
Well, it's a good one. They're good. Because I genuinely, I'm just curious. So I think a lot of people struggle with depression. And is a lack of vitamins is it related to depression at all?
So depression is a very common thing these days. I think depression has gotten to quote unquote.
I think it's a cultural thing these days.
It's almost gotten cool. Like it's what are you these days? And depression is like, oh, okay, cool. There's a whole group of people that you belong to now.
Yeah.
I believe it's 44% of the population suffer from depression.
No.
44% of the population, something like
Biden.
I pulled him off the street,
Is the
people.
president of America.
Hey, political in here, but let me tell you, things definitely have declined since. But I will tell you this: a lack of vitamins will not let the human body create serotonin, dopamine, and norepinephrine. This is the science of it. All right. We do understand that there's specific vitamins that you can put into the body that are the building blocks of serotonin, dopamine, and norepinephrine. We know what vitamins to put into our patients, and we've been successful taking, I think it was 5 very successful businessmen that have been depressed, that have come to us. Their family has been able to come up to us, and we've successfully gotten 5 patients out of depression with the use of vitamins. NAD helps your brain create and secrete more serotonin, dopamine, and norepinephrine. Gives you the energy that you need. You change the person's mood. And if you physically can fill up, I call it filling up the cup. So if the cup needs to be filled with happy juice, if there's no happy juice in it, there's no way that you can be happy. Now, pharmacologics there's a medication for depressed patients that is called an SSRI, serotonin reuptake inhibitors. What this thing does, it plays with the amount of serotonin that is in your brain and just puts it from one end to the other, and it doesn't let you get rid of that tiny little bit of serotonin. So to be medically diagnosed to be a depressed patient, you're supposed to get blood work. Blood work showing a low serotonin level, you are medically diagnosed as a depressed patient. So if you're taking a medication that is going to play with the little bit amount of serotonin that you have, instead of bringing up those serotonin levels, then by default and blood work, you will always be depressed. Why wouldn't your doctor, why wouldn't your psychiatrist figure out how to put something into your body that is going to make your body create more happy juice? If that cup of happy juice is full, there's no way that you can be depressed. But the problem is that no doctors out here are trying to help their patients come out of depression. The business is in
crazy.
keeping you a little less depressed.
Damn. That's wild.
So we've definitely taken care of a few depressed patients, and it's a blessing to see those dudes doing a whole lot better, man. Especially in the position that they're at. I mean, all four of them were CEOs of pretty big companies, and being the forefront of a business, I can see how if the captain goes down, the ship is gonna go down with it. So if we can take care of the captain, it's a blessing for all of those people that are under him. So you got great questions.
So it's
man.
like a solution to like just everything. It's just like a no-brainer. This is like all I'm getting out of it. It's like
It's how much value does a person have in feeling amazing? And then when you don't feel well, what is that really costing you? A lot of people that we talk to, they're talking about the cost of what it costs to do these vitamins. And they're not cheap. It's definitely not a cheap service. But the real question is, what is the cost of not doing it?
this couch is squeaking. I could hear it. It's like yeah. Absolutely. Nice.
Well, Darren, thank you so much, man. I apologize for
Appreciate
putting you
you.
out of nowhere.
It's all good.
Just in
It's all
case
good.
you didn't know, this is called Flu Talks. We are Flu Talks, more health, less bullshit. Do you think that we're sticking to the topic? Does it really feel like we're talking more about health, we're talking more about medicine, and there's less bullshit?
I'm sold, bro. Like for real, I'm sold. Like I like seriously after today, like I've learned a lot, and I truly want to continue to learn more and actually, implement this because I have issues with my skin. I have eczema, things like that I've been trying to find solutions for, and I've tried like a bunch of different things, and it's like eczema is like one of those things that has to do with your immune system, and they don't know the cause of it. There's a million different causes, and so something like this,
So they don't know the cause of it, but they're gonna sell you the solution to it. That's
yeah,
the
just
fun
a
part.
bunch of shit that doesn't
The
work,
fun part.
and you're going through, and then so it's crazy. I don't want to take too much time because I got somewhere to be,
man.
but I had seen a doctor, and I paid like $200-300 to see this doctor for 10 minutes. They looked at me, and all they did was write me a prescription. They're like, "Here, take this for 5 days." I take it for 5 days, nothing happens.
Prednisone, right?
And I'm like, "Yeah, prednisone."
I'll put money on that.
And then I'm like, "Okay, now I have to go back and pay another $300 for this doctor to keep trying things out on me." And it's like, it's crazy. It wasn't a good experience.
This is the system that we live in, man.
Yeah, so I'm from Canada, so we have like free doctors and everything. Coming to America, it's like I'm paying for like everything and every doctor's visit. I'm like, man, it's kind of discouraging actually, because like if you don't have health insurance, you're constantly paying ridiculous amounts of money for a doctor to not even like diagnose you, but to experiment on you, and it's crazy. So definitely, I've been looking at a lot of like holistic ways on how I can, just be healthy, really.
Well, hey,
Yeah.
not a
But
problem.
I found him. God works in mysterious ways, and like I'm grateful, honestly.
Well,
Yeah.
thank you so much for actually giving me your time. I appreciate it. Great questions, and I really hope that our viewers have been educated and have been answered some of the questions that you guys have, man. So stay tuned for the next Flu Talks. More health, less bullshit. And if we catch you on the street with a camera, hey, our home is your home. We can do these all day, man.